Can you admit from where you sit that we did indeed miss a few tricks?
Yes, clearly we did miss a few tricks, but I think it's not very fruitful to kind of look at where the blame should be. And we're not alone. There are countries like, for example, Australia and Far Eastern countries only starting in March. France has only kind of got a very fraction of their small, I think less than 1%. So it's not that we're really that far behind. We're starting now in February. It's maybe a month later than say even the United Kingdom, which is one of the first who started. But yes, I think I think it's a problem with the actual system itself. Vaccines, unfortunately, there's been a bit of I can only use one word, greed, from the high-income countries, because they've been buying up vaccine. I think 3 or 4 or 5 times what their population needs, and this has kind of left other countries, the middle-income countries, behind. So this is a problem.
Well, precisely because we could have anticipated that might happen. I guess I raise the question because if we made a shambles of trying to acquire the vaccine, even if you had millions and millions and millions of doses available, would we be ready to vaccinate? In other words, when they arrive here on Monday, what's our strategy to distribute the vaccine? Are we in charge of that, or are we also going to muck that one up a bit?
I can see you kind of got a fairly jaundiced view of this, Bongani. No, look, I think last night they kind of went into great detail, and we had stretched a lot longer than I thought, and it was very comprehensive. So, yes, I mean, that is what's in paper. Obviously, this has to be put into place, but certainly the kind of preparation is there. I think the kind of details are there in paper and planning. Obviously, we'll have to wait and see how successfully but I think we need to kind of, to some extent, have a bit of trust. We have had the undertakings from the government, from all the way from the president, that it's going to be a campaign like no other campaign that we've had. So the details are certainly have been kind of put down in very, very comprehensive, very in-depth.
Sure. Look, there have been...
Let's just see.
I agree with you. They are comprehensive. They've got ambitious plans, 40 million by the end of the year. Part of the problem we're going to have to contend with are people who are skeptical about the vaccines, people who are hesitant. And what we certainly cannot do is come up with grand plans that we're unable to implement. That is going to create a bigger trust deficit.
Yeah, absolutely. Look, I think you hit the nail on the head. I think one of the things which really is concerning is the vaccine hesitancy, and I think that's really, the onus is really put onto us as the health professionals to kind of get out the information, good scientific information to reassure the population. We also trust on you as well, the media, to kind of help us as well. We're not great communicators, so the media has to come to the party as well to kind of put across good information, scientific information, and kind of, put to rest all the conspiracies and the misinformation, because unfortunately there is a lot of that goes around.
There's also
social media.
There's also a question to be raised about whether or not we've been told everything we ought to know, even about the new wave. If you look at the number of people who are dying, if you look at how quickly those people have been dying, the number of cases, we're told, of course, that this new wave doesn't necessarily make one sicker, but people have had questions around, well, hang on then, why is it so many more people seem to succumb to this new wave than what we saw during that first peak?
Yeah, Bongani, I think you used the right word, seem. There's impression, certainly the clinicians and many of my friends who are clinicians have kind of also had that impression that it is more severe. But when you look at the actual data, because the data is what really kind of is a scientific truth. When they compared the data per population, obviously the second wave is far more extensive than the first wave. There are far more people getting infected, and that may reflect and the number of people being hospitalized, for example, may also reflect in the kind of downward spectrum of age, for example. But when you look at the data of severity between the second and first wave per individual who's got infected, it doesn't seem to be any different. And I think that's a fairly universal thing. In the United Kingdom, I know that they said their Minister of Health seem to imply that their variant caused more severe disease. But that's based on a few studies. Other people have contested that. And, I think that the jury may still be out to look at that. But certainly up to now, the data doesn't show that the second wave has been more severe per individual who's infected.
Let's fast forward to Monday. The vaccines arrive from India. What happens in the following days?
Well, according, I can just echo what was said last night because I'm not really involved in that. But there are various processes happening. There are batch inspections. There are various licensing procedures which have to take place. And according to the Minister of Health, that should be about 14 days to get through all those kind of various procedures, which he outlined last night.
Ivermectin, your opinion on what we're now hearing from the South African Health Products Regulatory Authority saying they're going to allow a controlled, compassionate use of this drug to treat COVID-19. Just give us a lay of the land as far as that is concerned. I mean, is it curative? Is it preventative? What's the official word?
Well, I think there have been claims that it may do both. But these are claims which haven't yet. They may still be, but haven't yet been proven to the satisfaction of the licensing authority. They are the guardians, really, of the safety of these medicines and so on. They need to be convinced from good scientific evaluation that it is safe and it is effective, and that can only come from well-controlled clinical trials. So at the moment, that data hasn't been forthcoming, but I believe that there is a controlled trial which has been started, I think at the University of Free State, and hopefully that will tell us, if the data is good, then of course it will be licensed. But until we get to that stage, they can't license it.
So I mean, what does the approval mean then? Does that mean I can go, presumably, if not to my doctor, to my vet to ask for ivermectin? How many can I take for how long? How does it work? If that's the announcement we heard yesterday.
Yeah, I think that SAPRA was about to kind of give details. It's supposed to be a more streamlined. You see, up to now, you could apply what's called a Section 21 exemption. In other words, but that was a rather cumbersome administrative kind of procedure. I think that's now been speeded up or streamlined. The exact details of which I think SAPRA is about to kind of give, in other words, exactly what you're asking. How is it going to work? But I don't think I think that's supposed to be coming either today or tomorrow. They're going to make that announcement.
So don't rush and buy it. Wait and see.
Well, at the moment, it's actually illegal to buy it, and it's illegal to dispense it. But presumably, those rough edges will be kind of smoothed out a bit now.
Right, Professor Barry Schoub, the Chairperson of the Ministerial Advisory Committee on COVID-19, on the line there. Are you comforted? Are you given some sense of confidence about the plans going forward? Or does that raise even more questions in your head?
Your voice making a difference.
This is Breakfast with Bongani Bingwa.